Let me try that again. I was on mute. Welcome to HCDVCC Connects. I'm Fisha, and welcome. It is Monday. I hope everybody is staying warm out there today. We are here for another episode of Harris County Domestic Violence Coordinating Council Connects. And our goal is to connect systems and community members so that survivors of domestic violence can experience greater access to services and safety through collaborative efforts. As always, we welcome you here. As you come in, for those of you who are watching live, please go ahead and feel free to comment, say hello, interact. We have another great episode today. I am excited to have with us Chris Graves, who is with the city of Houston. As many of you know, January is National Human Trafficking Prevention and Awareness Month. And so we have with us here today the Associate Director of Human Trafficking and Domestic Violence. And so just a little information about Chris Graves. Again, he is the Associate Director of Human Trafficking and Domestic Violence in the Office of Mayor Turner. And he co-wrote phases 1 and 2 of Houston's Anti-Human Trafficking Strategic Plan, which is one of the first in the nation in which to address this issue for effective systems change. And as you know, with the Harris County Domestic Violence Coordinating Council, that is the work that we do. It is about bringing systems together, recognizing that not just one system, law enforcement, the shelter programs cannot do it alone. It is about all of us coming together as a community. And to share more information about how we can work together as a community, please help me welcome Chris Graves. Hey, Chris, how are you?
I'm doing excellent. How are you doing?
I am good, and I thank you once again for joining us today.
No, of course. I really appreciate the opportunity, and really the coordinating council has been such a great partner in our efforts on the domestic violence front.
Yes. I gave a brief introduction, but just share just a little bit more about what you do and what you do there at the mayor's office as regarding human trafficking. Then we'll dive in to also talking about exactly what is human trafficking.
No, of course, I'd be happy to. So actually, I joined the anti-trafficking division in 2016. So originally, our division was focused specifically on human trafficking. And actually, I was happy to be part of the effort of Houston being the first really major U.S. city to address trafficking at scale at the municipal level. Of course, there's been tremendous law enforcement response to trafficking. A lot of times they have task forces at work that really cross federal, state, and local lines. But really, at the city of Houston, there was a tremendous opportunity to really address it at the community-based level. And so when I first joined the office, I was happy to co-write really the first phase of the strategic plan. And actually, we're in our third phase currently. So really, we've completed the vast majority of phase 1 and phase 2. And really, as of right now, we're really focusing on addressing violence and really focusing on economic empowerment of survivors. We've done a lot of work to address kind of gaps in services, whether we're talking about shelter or psychological services, but really that economic empowerment piece was just so crucial. And so as the associate director, I really work on the operations side. So I make sure that our programs and operations are running efficiently. And then I do a lot in terms of systems to collect data and then analyzing that data to really determine what kind of impact are we making. So actually on our website, we have 5 years of impact reports. So if you want to know what our office is doing, how we're making a difference at the city level as well as nationally, you can view our impact reports beginning in 2017.
Okay, excellent. And I can see that Rebecca has put in the chat box humantraffickinghouston.org. So definitely can get information there as well. So I always like to start off with definitions to make sure that we're all saying the same thing, Chris.
Of course.
Because I know that some people talk about smuggling and then there's human trafficking.
Right.
Will you define for our audience who are here now and those who will watch the replay the definition of human trafficking?
No, of course. So really, trafficking is embedded in federal law. There's a wide-ranging law called the Trafficking Victims Protection Act. It's gone through several reauthorizations, and oftentimes trafficking is also embedded at the state level. But really, when we're talking about trafficking, we're talking about force, fraud, and coercion to compel a commercial sex or labor act. I know that's a little bit legal, that's a little bit technical, but if I can break it down a little bit. So oftentimes when we're talking about sex trafficking, we can be talking about people trapped in the commercial sex industry who are victims, who were forced to sell their bodies to another. We're talking about labor trafficking. Oftentimes that can be someone trapped in a industry, that can be restaurants, that could be traveling sales crews, but really they're victimized as well because of force, fraud, or coercion. So we're talking about force, that can be brute physical strength, making someone do a labor act, making someone do a sex act. They can be defrauded into it. Oftentimes in cases of labor trafficking, you can have a foreign-born individual who thinks they're coming to the United States for an IT job when it winds up being a restaurant job, and really they work without pay, they live on site, things like that. Or we can talk about coercion. Oftentimes in sex trafficking, there can be threats against family members. You have to stay and do this, otherwise I'll hurt your family members. That's kind of what the traffickers are saying. So really, those are the core elements, that force, fraud, and coercion. It can be in the sex industry, or it can be also in different labor industries. And really, you have such a wide range of venues. If you're talking about sex trafficking, illicit massage parlors, residential brothels. If we're talking about labor trafficking, as I said, it can be those restaurants, traveling sales crews, pop-up carnivals. And really, trafficking cuts across all demographic lines. It's not just one person. It can be it cuts across race, ethnicity, gender. It's not just foreign-born individuals, it's also domestic individuals. It's even minors who are victimized in this really terrible practice. And one thing I did want to mention is because you brought up smuggling at the start, and oftentimes with the headlines, they'll say trafficking, but really it's a smuggling kind of incident. So if I could parse that out just a little bit. With trafficking, you always have that force, fraud, and coercion, whereas with smuggling, you don't have that. And also in smuggling, it's a kind of an act of crossing an international border, but with trafficking, you don't have to have movement. It's not a necessary part. Although trafficking, you do have movement in a sense that people can be trafficked location to location. You may see that in nail salons or in illicit massage parlors, but you don't have to have movement. Someone can be trafficked in their own home city. So that's kind of really the core difference with the trafficking and then smuggling. And then I'll just say more broadly, our office, and I know we'll talk about services later, we serve kind of confirmed victims as well as potential victims, because oftentimes you have individuals who are very vulnerable to trafficking. They might have been out of a domestic violence situation and they have a lot of vulnerabilities, and we want to mitigate that. And we also want to serve them to prevent them from falling into a trafficking situation. And I know maybe later we'll talk about, domestic violence, trafficking, similarities, differences, things like that.
And that's actually a great segue, Chris. Number one, thank you for making that distinction, because I know that in conversation and doing training, that sometimes there seems to be not the ability to distinguish the two, and based on my knowledge that there is that distinction. So thank you for clarifying that. And then moving forward, definitely as HCDVCC, one of our primary goals is around domestic violence.
Mm-hmm.
And the fact is that I believe that there is a correlation between domestic violence and human trafficking. Can you just do like a brief drill down on that?
No, of course. And one of the things kind of our office has recognized was trafficking victims have intersecting vulnerabilities. They can be in a domestic violence situation and that can push them into a trafficking situation. So there are various kind of push and pull factors. Some commonalities between them is oftentimes a trafficker may be in the guise of an intimate partner. Oftentimes there can be a process of grooming. So for example, you see that really with domestic born victims, they can be minors, they can be adults. There's a process of grooming, preying on those vulnerabilities in the guise of being a boyfriend, but then there's a gradual process where that individual is coerced into selling their body to another for the trafficker's profit. So really there's kind of the trafficker and the intimate partner it can be blended in a trafficking situation where they're in the guise of an intimate partner, but really they're coercing someone to do something really against their will. Both with traffickers and domestic violence abusers, they utilize power and control. It can be psychological, it can be physical, but they exert their power in one way or another to make another do their bidding. Now, with domestic violence, there's a really interesting article, and I know maybe on the call there are some service providers. There's a really interesting article that I can link y'all to that talks about push and pull factors. Because oftentimes when an individual is in a domestic violence situation, because there's undergone that trauma, they can fall prey to a trafficking situation once they're out of that domestic violence situation. So it can be kind of a push where they're pushed into a trafficking situation, or it can pull them into it. So it's a really interesting article by Dorchen Lighthold. She's a service provider in New York, and I can provide that link a little bit later. But really the core difference though, so although there are those similarities, intimate partner with the trafficker, there's the commercial transaction that's really the core difference, because the trafficker is financially benefiting from the arrangement where they victimize another person. With a domestic violence abuser, they can also profit. So for example, in certain situations, or difference.
Okay, thank you. And as you were talking, and thank you for that. Definitely, you can get that information about that article, the push and pull factor. That sounds very interesting.
Mm-hmm.
Just very briefly, I remember I saw something this past weekend about a young lady, and I actually believe I saw her mother speak at an event a couple of years ago, talking about that correlation between domestic violence and human trafficking. Was a young lady here from Houston a few years back, where she had engaged in a relationship. It was that power and control factor where her boyfriend got her a phone. Only he could contact her on it. Long story short, she met him actually at church.
Okay.
And then at one point, he took her on a business trip to Dallas, and she talks about how that's when everything changed. That there had been some warning signs prior. However, once she got to Dallas, she was full blown thrown into a human trafficking situation where she was forced into prostitution. And so, definitely just wanting people to be mindful that it can take that turn.
Yes, it can, and it can be very subtle. There's that grooming process, where oftentimes they're trying to romance the victim, trying to pull them towards them, but then it can turn to forcing them on the street, selling themselves for the trafficker's profit. That can definitely happen.
So a lot of times what I have heard, and I want you to bring clarity to it, is that Houston is the #1 spot for human trafficking. Share with us exactly how prevalent is human trafficking in Houston.
No, of course, and oftentimes when you're watching the local news, you're reading the newspaper. Oftentimes there are kind of the really catchy headlines. Houston #1 for trafficking. Houston as a hub for trafficking. But oftentimes when you dig a little bit deeper, you can see it's a little bit more complex than really the headlines suggest. So on the one hand, oftentimes what they're talking about is calls to the national hotline. So in every state, you can call the National Human Trafficking Hotline. This can be a community member, they're wanting more information. It can even be a victim and they're making an outcry and they want services. It can be either one of those two. And that number, just for everyone's reference, 1-888-3737-888. Now, Houston has a large number of calls, but we have to remember that with calls, it can be a community member, it can be them wanting information and not necessarily an indication of victims coming forward. So oftentimes when the media says, Houston #1, they mean calls. But in one sense, you want calls because that's an indication that the community is engaged. They know the indicators of trafficking, or they suspect human trafficking, and they're taking that extra step to call the National Human Trafficking Hotline. So calls is definitely a positive indication. And in Texas, and particularly in Houston, we do have a very robust trafficking response. At the state level, whether that's child sex trafficking, or even in terms of the city of Houston or services for adult victims. Now, if you do go to the National Human Trafficking Hotline, you can find state numbers. You can do state by state. right now, Texas is second in terms of cases of human trafficking. That means there's a confirmed case of human trafficking that, let's say, law enforcement or a service provider has identified. And so in 2020, if we're talking about Texas as a whole, there were 987 cases reported just this year. And then there were about 3,500 contacts made, some from community members, some from victims, but some of the contacts kind of translated into human trafficking cases. But the big kind of issue is that we know trafficking is under-identified. So it's hard to say how prevalent it is. So for example, there's a really robust sex trafficking response, not so much with labor trafficking. We know a lot of times labor trafficking is really under-identified in comparison to sex trafficking. So we have call and case numbers from the hotline, but we don't know how actually prevalent it is because of that under-identification. So a lot of what the city has been doing since 2016 is to increase that victim identification in different industries and venues where people hadn't done screenings and referrals before. So for example, we know that victims visit hospitals. So to that end, we had developed a kind of a social service platform that engaged healthcare partners to start to screen for trafficking in healthcare institutions. And so right now, the goal of the city, and particularly the mayor's office, isn't necessarily on kind of getting an estimate of numbers. It's to first just increase identification by engaging those industries and venues. And we've seen a really great response so far to show that the system is working. So for example, in 2 years, so we had engaged the county hospital, the Harris Health System. We placed a human trafficking psychology fellow who did screenings in the inpatient psychiatric unit. In 2 years, they had about 170 referrals for screenings and then 125 confirmed cases of trafficking, just engaging that healthcare partner. And that was just in Houston. So really, we think a lot more work has to be done really at engaging those venues where we're not screening. They can be WIC centers, they can be health centers, they can be doing direct outreach with traveling sales crews or people selling things on the corner to assess for possible victimization. So really the goal has to be increase in identification.
Wow. What might be one or two screening questions that someone could ask if they're in healthcare or even education?
See, it can be very tricky because especially with screening. So for example, a lot of times the screening tool is kind of dependent on the venue. Do you know where you're doing the screening? So for example, a screening tool would look one way if you're screening someone in an illicit massage parlor, and it would look somewhat different if you're screening for someone who may be homeless, but who may have trafficking victimization. So for example, we do a lot of work in terms of policy advocacy in illicit massage parlors to make sure that law enforcement can really access these establishments because they're venues for commercial sex and sex trafficking. One screening question that we've used in the past in illicit massage parlors is, do you provide special services? Because oftentimes the victim who appears in these establishments is East Asian, so they can be Korean, they can be Thai, and oftentimes there's a stigma attached to saying something like selling sex. So the special services was a more trauma-informed way to approach the question and to get a better response out of them. If we're talking about screening the homeless, you may ask something like, have you ever traded something for sex? Now, but oftentimes you can get a lot of false positives because they may be engaging in survival sex, and it might not necessarily be a trafficking situation. If it's in a healthcare institution, you can ask. So, for example, some indicators that someone might be trafficked is if they're visiting maybe a safety net hospital, and they may notice bruising or signs of abuse. If they've been victimized in the commercial sex industry, they may have a history of STDs or STIs. So when you see a kind of collection of these different indicators, oftentimes you may not want to do a screening question, but you may want to do a lot of motivational interviewing. Tell me more about the bruise that you got. How did that come about? Or I've noticed, a lot of STIs in this regard. Can you tell me a little bit about your history? And oftentimes the response you'll get is better than if you're asking just a standard screening question,
Right.
because the motivational interviewing will help them get the information out that you're wanting, and hopefully provide them in the direction of services.
Okay. You used a term that I have not heard of, and that's another reason I love doing these HCDVCC Connects, because it's an opportunity to learn.
Mhm.
You used the term, I believe, safety net hospital.
Mhm.
So tell me a little bit more about that.
Yes, it was. So when we very first started so we have a direct services platform where we have, mayor's office case managers, and really the case management is kind of more or less in a dual system. So we have two case managers at the shelter level and then one at the hospital level. We engaged at the hospital level because we knew from research that trafficking victims are visiting healthcare institutions. That can be clinics, it can be private, it can be public, but especially for those institutions that more or less serve maybe people without, maybe they're uninsured,
Okay.
underinsured, they may qualify for Medicaid. So they're visiting more or less the safety net hospitals because they don't have insurance, they're underinsured and can't cover all the costs associated with visiting the ER. So it's kind of the hospitals that provide that safety net for individuals who don't have maybe a private employer and a private health insurance plan.
Okay.
So it's the hospitals for the most vulnerable, and that's kind of where our target was.
Okay. Well, I will definitely hold on to that term. Thank you for explaining. All right. Well, let's go ahead and move on. So you've done an excellent job of, number one, defining what is human trafficking, talking about
Mhm.
some of the work that is being done. So tell us, how can the community members be a part of the solution? How can the community be more engaged in working with the city of Houston on this issue?
Well, I'll tell you, uh, one excellent way. I'm hearing some feedback. Are you able to hear me okay?
Yeah, I hear you fine.
Okay.
Yes.
Um, so we definitely want the community engaged. We want the community mobilized. We want them to have the resources to be able to do the kind of work they want to do. So actually, if you visit our website, we provide a lot in terms of toolkits. Right now, we have about 7 or 8 individual toolkits. What these toolkits are designed to do is to give people the resources if they want to raise awareness, engage in some kind of policy advocacy, maybe in their local school district, in their local city, if they want to run a social media campaign, if they want resources as far as disaster awareness in regards to human trafficking, really the nexus between disasters and human trafficking, we provide them all of the resources. So, for example, if we have someone on the call, maybe they're listening, maybe it's someone who's watching after the fact, and they say, I want to be engaged in the local school. I want to run a social media campaign. I
Hmm.
want to run a social media campaign, maybe with a school board, one of the school board members, maybe with some teachers, maybe in my local civic club, maybe in my super neighborhood. I want to do a social media campaign, but where did they begin? So essentially, we provide a social media toolkit. It provides you with all of the images, the text, the campaign calendar. You can even remove our graphics and logos. Maybe if you wanted to add one of your own logos, maybe you have a super neighborhood, you have a logo. Maybe you wanted to add the logo of a local school district because you're running it in collaboration with that school district. So essentially, we give you all the resources. You can rebrand it, and then you can run with it and then raise awareness in your local area. So, for example, we've done social media campaigns before, but they've been targeted, of course, to a Houston area zip code. If we have someone who maybe lives in unincorporated Harris County, maybe they live in a surrounding locality where, our reach is limited, they can do their own social media campaign, target their zip codes, run it in collaboration with your local stakeholders, maybe faith-based leaders, really to raise awareness and prevent trafficking in their area.
Wow. Okay. Well, Rebecca has put that in the chat box, and I'm going to go and click on the link myself in this interview.
Cool.
So we've got definitely ways for our communities to be engaged. Let's go back and dovetail to what services are available for survivors of human trafficking.
Yes, and so one of the big kind of gaps that we had assessed early on was shelter and psychological services. We had heard from service providers that number one, it's hard to find a shelter bed if they have a victim and they've engaged in an outcry and they need a bed because they're escaped from their trafficker. We also heard psychological services. It's really hard to access um, kind of practitioners and psychiatrists, psychologists, really to provide the specialized care that a victim needs because of the trauma they've undergone. So our services program is really tailored to those needs. We have case managers at the shelter level. They receive a lot of public health referrals. So they receive them from domestic violence agencies, which can include the Houston Area Women's Center, from homeless agencies, including the Salvation Army, as well as by direct outreach kind of agencies. They get those referrals. Not only do they provide intensive case management, if there's a need for a shelter bed, they can provide them and see options for short-term emergency shelter, and there might be the potential for longer-term housing because we really kind of leverage the shelter system, because by doing so, then you can access that longer-term housing, whether it's rapid rehousing. There are a lot of different programs available based upon the needs of the particular person. Now, in addition to that, if they need psychological services, if they need to talk to a psychologist because of the trauma they've undergone and they're trying to recoup and regain their kind of integrity and their peace of mind, we can provide them access to a psychologist through a human trafficking clinic with our healthcare partner. So really, we kind of address the case management, the housing needs. It can be short-term emergency shelter, and if they need psychological services, but also any kind of referral they would need for medical and mental health care, we can provide because of that hospital-based connection. Now, once they're more or less stabilized, maybe they're in a longer term housing situation, we've begun to do economic empowerment efforts because we want victims, survivors to be independent, to have a good paying job, to be insured, and to really help them be resilient in the face of diversity and to prevent them from falling back into a trafficking situation. So we launched the Common Good Agency actually at the start of 2021. We've run it through the whole year and continue to offer our services. It was based more or less on a pilot program, but we engage survivors in 3 ways. That can be through job matches, that can be through info sessions with trusted industry partners where they have access to hiring managers, or it can be through social media and entrepreneurship assistance. And so it is in the pilot phase, and we are starting to gradually upscale it. But over the course of 2021, we saw 14 jobs secured by survivors of trafficking, but also domestic violence. If anyone is listening and they may be in need of services, or they are interested in reaching out to one of our case managers, I can provide the phone number where they can get more information.
That would be great, Chris.
Definitely, I will put that in the comments. Actually, I'm not sure how to access the comments. I'll make sure to follow up to provide it.
Okay, excellent.
Okay.
And I believe, I want to say last year we actually did have someone from the city of Houston come and talk about the economic empowerment piece.
Yes,
And
Jessica.
yes,
Yes, that she's our economic empowerment, so she's right down the way from me.
yes, definitely. So I don't know if we can get her information. If there's employers who are saying, "Hey, we'd like to partner with the city of Houston," because one thing I know, and we're about out of time. I have really enjoyed our conversation, and working with survivors of domestic violence. I was with the Bridge for 19 years. I know one of the programs that was created is that I worked with survivors to become entrepreneurs.
Yes,
Because of different barriers. It may be someone who had barriers to getting quote unquote gainful employment as opposed to working under the table, things of that nature. Having a very spotty work history.
Yeah.
And so to watch the women bloom and blossom and be able to use their gifts and their talents.
Yeah.
And, January is also Financial Wellness Month. And here is the reality. I believe that when we look at some of the root causes of domestic violence, sexual violence, human trafficking, that one of the root causes is around economic instability,
Yeah.
disadvantages, and in order to equip people to truly embrace their freedom is to
Mhm.
give them economic empowerment. So
Yeah.
I think that this is so great that the city of Houston is creating this program.
No, I think you're exactly right, and you really hit it spot on. Really, that financial abuse piece can really be at the core both of a trafficking situation, but also in a domestic violence situation. And so that's why with kind of our common good agency, it's open to referrals from case managers from a trafficking agency or a domestic violence agency. And I can also share you the link for referrals.
Okay,
If there's
great.
maybe a case manager listening, they have a client in mind, they want to potentially sign them up for services, I can provide that link and it'll go right to our associate, economic empowerment associate.
Well, that is excellent. I know that we have one person who usually listens in with us on a regular basis, Jimmy Wright. So I just want to give her a shout out. I've been meaning to put her comments up here. Jamie is a survivor of domestic violence and is doing some amazing community based work. And so she's had some really great things to say throughout this interview, this conversation we've been having today. And I know that she is also very much engaged in the faith community. And for me, I think it's so important also for the faith community to be engaged. And so I believe all of the tools that you've given today are good for all community members,
Mhm.
and just to be able to recognize, respond, and refer those who may be in human trafficking. So, Jamie, thank you, and everyone else who has been here live. We appreciate you being here. We're going to wrap up by asking you one final question, Chris. And
Mhm.
again, thank you so much for being here.
Mhm.
Is give us one challenge and how you've overcome that in the time that we have left.
So one challenge that has come up. So maybe if I could talk a little bit about more about the economic empowerment piece,
Yes.
because I think it's an interesting example about kind of a challenge we saw and then our way to try to address it. So, we've been engaged in services since 2017 with our dual case manager system. Um, Oftentimes, over the course of several years, and because of really the trauma that victims have undergone, they've been engaged in intensive services for 2, 3, 4 years. When we were looking over our numbers and we were trying to assess outcomes, we were thinking, what else could we do to help survivors become more independent? We can provide them with shelter, we can ensure they get medical care, we can ensure they get mental health referrals. But what are we doing to help them address jobs and securing jobs? And oftentimes, when we looked at it, it differed agency by agency as far as economic empowerment. One agency might have a connection with workforce solutions. Another agency might have a personal connection with a HR hiring manager with one particular industry. But we were thinking, what could we do on a systematic front? So that way our clients could benefit, but also clients of other agencies. So originally, the Common Good Agency had developed out of a pilot program we had done in 2020 that focused on uh, skill-based training, so either sewing or the retail industry. What we saw was that really survivors need more intensive one-on-one attention and really job matches that were customized to what they wanted to do. And so really the Common Good Agency was born in really 2021. One of the things that we did was do customized career profiles, match them with job opportunities, and then we started doing info sessions because we realized, it's one thing to send in an application and to help a survivor send an application. Well, what if they had access to an actual HR hiring manager who can make a decision and also who was attuned to the needs and challenges of survivors and really that past victimization? And so, really, in March of last year, we started doing info sessions with a trusted hotel partner who had that sensitivity, but who also wanted to make an investment in survivors for their financial independence. And really, we've seen kind of challenges along the way. We were recently looking at outcomes and trying to better improve retention. It's one thing to help a survivor secure a job. It's something else to make sure that they have the tools and resources necessary to retain it. So
Yes.
something we started to do recently is a workforce readiness class where we make sure to have a group of survivors talk about the skills they'll need to retain a job, things like punctuality, knowing policies and procedures, expectations of the employer, because we want them to be prepared and to retain the job going forward. So we hope to continue to improve our process and really improve outcomes for our survivors, in 2022.
That is huge. And I also love when you talk about being able to actually retain the job, because it's one thing to get it.
Yes,
to retain it because of the trauma, because that trauma is there for quite a while. And that can definitely hinder one's ability to stay gainfully employed. Well, look, I don't want to take any more of your time. It has been some excellent information. We thank you so very much. Any final words that you'd like to share with our audience as we come to a close?
No, I just want to say that this was a great opportunity, and I really appreciated it. For more information on our office and ways that you can engage, so for example, I mentioned the social media toolkit. I know your colleague has already put our website in the chat. That website is kind of a one-stop shop, not only to see the work we're doing, but also for you to get resources to do your own kind of work. If you want to do a social media campaign, if you want to do a broader multimodal media campaign, we can provide you with those resources. So visit our website, and if you have any questions, you can email us at the email address on our website.
Awesome. And just as a side note, this is something that I have committed to on a personal level. Yes, January is National Human Trafficking Awareness and Prevention Month. However, here's the reality. It happens 365 days a year, 24/7. So I'm going to say, even though we're coming to the end of January, go to the website, get that toolkit, and let's keep it top of mind for the next 365 days. Because just because January 31st is rolling around does not mean that human trafficking does not exist in Houston, surrounding Harris County, and on a national basis. So go, please, and get engaged in getting this information out. And with that, thank you so much, Chris, for being here today. I'm going to bring you back down to the virtual green room, and I'll be with you momentarily. All right.
Thank you, and thank you, everyone.
All right, well, I hope that everyone enjoyed today's conversation. It is always a pleasure to come here and to visit with you. Next Monday, January 31st, we have a guest. Her name is Julie Owens, and she is a domestic violence expert, and her area of expertise is working in the community of faith. So for about the last decade, she has been working with ministries to help them to be able to recognize, respond, and refer those who are in abusive relationships, and how faith-based communities can begin to have conversations in their ministries about this issue. Because here is the reality: even if a person has a faith, even those in faith-based communities many times are still dealing with the issue of domestic violence. So don't miss next week as we talk with Julie Owens about how the faith-based community can get engaged to bring awareness 365, 24/7 about the issue of domestic violence. I'll see you all next Monday. Everybody have an amazing week. See you next Monday.